Hi, everybody. It's me. It's Dr. Kessler from Lorain County Community College, and welcome to today's co-video. I also would like to share with you that today is World Health Day, and my today's presentation is really goes out to all the people who are working in the healthcare system, all the people who are working to keep us safe and their struggles. I have talked to a lot of my former students, and I will tell you that you're doing great work out there. The people who are doing the great work out there, and we need to support them in every way that we can, especially by trying to reduce the stress. Today, well, first of all, let me tell you my temperature today is 96.8, and that's 36 degrees centigrade. And I want to talk more about the the whole concept of, is it okay to come out? Is it okay to come out yet? Is it okay to end the lockdown, end the stay at home? And the answer is very quickly no, it's not okay yet, and we need to make sure that things are okay when we do. Other countries that have tried the more sharper curve, stack the curve, not flatten the curve, stack the curve higher, have gone through a lot more difficulty, a lot more issue, a lot more deaths. It is important. What we are doing here in Ohio is really good, and I would argue not quite enough yet. I think we need to really push down because we have a healthcare system that is stressing at the seams. There's a story here on this slide about how there are people who are trying to rebel against the stay-in order, and this is really going to defeat the whole system. In China, they're getting ready to reopen, but they're reopening very, very slowly. They're relaxing it very slowly in Wuhan City, where the pandemic started. So how will we know when it is time? How will we know? What are the principles that we can use to establish when we can reopen again? Well, there is a report out, and this is just a suggestion of guidelines of some criteria that we might use to relax things a bit. And it is the American Enterprise Institute had put out this kind of response. Let me go through it. And I consider these as minimum kinds of standards that we would use to decide when to go back. And the first one is probably the most important one. The hospitals need to be able to return to normal. They need to return to operating as a usual facility where they take in people who are, have broken bones and things like that, and not have to worry about taking care of all the COVID patients, and not responding in crisis mode. That, of course, absolutely includes 100% that they have enough materials to work with, like PPE, personal protective equipment. For those of you who don't know what all the jargon is and all the initials are, they need to have N95 masks and all those kinds of things. And I will tell you, I have talked with students who are working in healthcare right now, and they don't have enough. They are not doing things strictly the way that they've been taught, and they're nervous. Remember, everybody who is home right now, let me just share with you a little bit here. Everybody who is home, if you're home right now, you're with your family. And those that are in the healthcare system leave and go to work, just like, remember the old days when we all left every day and went someplace? In the old days, everybody went to work. Nowadays, only some go. And I want you to think about this for a second as you're struggling through your incarceration in your own home. I've got the fireplace going on behind me, so I'm nice and cozy. But I'm thinking about people who are questioning, children who are questioning if mom and dad who are going off to work in a hospital are going to return. They may never see them again. They may end up becoming patients in a hospital. So it's very important that we do our part. This is a shared responsibility. This is a national government emergency, and we need to do our part at doing it. So we have to get the hospitals back to normal. We need to be able to test at least everybody who has symptoms. We need to be able to do many, many more tests than we're doing now. In some places, there is a real shortage, and you just don't know who could potentially be carrying the virus. We also know a lot of evidence is accumulating. I've been reporting on it now and then about how the asymptomatic individual is somebody who can be passing the disease around. And that is, we need to know who they are. That is an important kind of a thing to do. One thing that we need to be able to do is also operate with standard public health procedures. One of the greatest things that you can do is when somebody comes up positive with an infectious disease, you trace their steps. And in this case, you need to trace about a week back, and you look at all their steps, and you need to be able to handle that. You need a system for handling those cases, because this is not going away. This is where we have to respond to cases as they flare up. And I'm talking about the future. And then finally, we need to get to a point where we're sustaining reduction in the number of cases for about 14 days. That is a really important thing. All right, I've got one thing to share here. I wanted to share, this is a web site. It is a, just touched my face, so this hand is now dirty. This is a website from the New York Times. They put out a video about the disease that is taking so many people down. Not all people with COVID get this. This is a severe lung disease, a severe lung disorder. And you see it with, we saw it with the kids who were vaping, for instance, and the vitamin E that was getting into their lungs and causing issues. And we call it this lung distress syndrome. And I think you should watch it, and I think it's a worthwhile thing to do, because we have to take care of our lungs. That is really an important thing. Those of you who are home, enjoying this time where you're not doing things, take time to breathe a little bit. I mean, really seriously, and enjoy that privilege of breathing. Take in a good deep breath and let out a good deep breath. And one of the great things is that as we are staying and sheltering at home, we are not producing pollutants. That was one of the things that I shared with you a few weeks back in China. They were talking about how the air pollution was getting much better. And these are things that can cause a diminished capacity. These are things that are pre-existing kinds of conditions that can cause lungs to fail quicker and easier. So, and we know that there's a higher COVID risk. So, again, today is World Health Day. I don't know if you knew that, and obviously it seems like every day is. But I really want to just take time to thank the people who are helping us and in seeing and dealing with some horrendous things, dealing with on both sides of the sterile field. People who are dealing in ICUs with some terrible stuff that they're seeing and some terrible things that they're having to do, like communicate to family members that their relative has passed, and this is a tremendous toll, tremendous burden we're putting on our fellow citizens. Stay home. That's the best thing you can do. This is Takeout Tuesday, by the way, so make sure you support your local businesses. And I want to thank all the helpers. The helpers are the people in the hospitals right now. They are good people doing a real hard job right now, and thank them for what they're doing. Thank the people in New York who are doing what they're doing and fighting the battles and the battles yet to come on this. So I remind you to be good to each other. Stay home. Wear a mask if you go outside. And may you persist like a lentivirus. Thank you.